Hello, I'm Sarah Jane, and I'm the Clinical Director of the Rehab Hub in Glasgow. And I'm talking here about help with verrucas. So, one of the things that we get asked a lot in clinic is, I've tried everything with my verruca and nothing is working. What can you do to help? So, if you don't like verrucas, turn off. They are super, super common. It doesn't mean that you're unclean or dirty or any of that. It's just sometimes it's just a bit of bad luck, and some people are just more susceptible to them than others. So, in terms of verrucas, many patients come to us and they have tried over the counter things. They've maybe had some treatment, maybe like freezing, so liquid nitrogen, these kinds of things on it, or they've tried things like Bazooka That Verruca. And it does tend to be children, a lot of parents getting very frustrated with things not working. And a lot of the time for us, we are basically just educating. Now, the first thing that I would say about Verruca is that it's not going to cause you or anyone else any harm. So you can completely leave them alone. There is no need, unless it is causing you distress or it's giving you some pain. Sometimes they can be quite painful. You don't actually need to do anything to them, and they might just spontaneously clear up. So that's first and foremost, I want to make that clear. So that's something that we always talk to our patients about, is just making sure that they have all the right information before they then start moving on to treatment. If you have started treatment or doing treatment and it's just not working, or possibly spreading, so this is another thing that we see in clinic, is that like this afternoon, for example, I had somebody messaging just their words saying they're freaking out because another one's appeared next to the current one they've got, and they've now got a wart on their finger as well. And that's not uncommon. So first things first, don't panic. Sometimes they just spontaneously clear up themselves. But what we do have in clinic is we have a couple of options. So we are podiatrists, so this is our speciality. And as such, we have a range of options that you're maybe not aware of. But can I just be very clear again that remember, you do not have to do treatment on this if it's not causing you any pain or distress, that you can leave it. If you're finding that it's really causing you distress, you really don't like it, it's sore, it's going macerated, we see all sorts of let's just say presentations here. So I'm going to talk you through the options that we have here at the Rehab Hub. And if you are struggling and worried about a verruca, or maybe your child or maybe you has got one, we always offer a free 10-minute consultation. Now, that generally will want to be in person if it's a verruca, so that you can see us face to face and we can look at that verruca for you. But we're also more than happy to talk about any concerns that you have over the phone. So we just do that, and the link with that is there. So if you are concerned and you want to come in and see a podiatrist free of charge, then just go ahead and book yourself in. We can generally see you within 24 hours. Now, the options that we give you are dependent on you, dependent on your child or whoever you're bringing in. So it's impossible to say this is what we would recommend. Sometimes we just recommend you do nothing, that you just occlude it, that you just cover it up, leave it alone, and that's it. So sometimes we will just give you that, maybe that reassurance that you need. Sometimes go into the pharmacy or get into your GP. Nobody will give you really the time of day with these things. They'll just point you in the direction of the aisle that's got usually the Bazooka That Verruca or whatever it is on the shelf. And many of you very frustrated with that and feeling a bit like, where do I go with this? So a podiatrist is always the first person that you should see for these types of things, but I appreciate that you maybe think that it would be a GP. Your GP or the NHS will not treat these. It's not within the remit because it's not life-threatening in any way. They're just an annoyance. So your GP will probably just say, go and get something from the pharmacy, and your pharmacy will just point you to something like the Bazooka That Verruca. Now, do those things work? Sometimes verrucas will just clean up themselves, as I've said, but sometimes they don't. What concerns me as a podiatrist when you're putting something caustic on your tissue is that you're putting some sort of acid on your tissue, and it's the mess that we then usually will see, because usually by the time somebody's coming in to see us, they are in a bit of a mess. It's the skin is all macerated, if not created a wound, or they've made a mess of the situation. So that's usually what we're seeing. And so just what I would say is just be cautious with them if you are using those kind of things. In clinic, what we have, so I've pulled this up here. This is the page that if you click the link that's with this, that you will go to, and it's just got a little bit of information about how to book, ask us questions. You can WhatsApp us, book a free consultation. So our first line treatment is Swift. Now we use this microwave technology, and I'll jump over to the Swift page. And basically, what is Swift? And it's essentially a treatment for lesions of the skin. And it's using microwave energy, and it's delivered through this little device that we have. Each little one of them, I don't know if I've got a wee picture of it here that I can show you. It's quite nice and funky. I wonder if this will go. Let's see. Maybe. It's not showing. This is just a wee promotional video from Swift. But essentially, each little person gets their own little individual nozzle, and we essentially zap it. That's pretty much what we do. So we put the microwave energy through, and for most people, they will need 3 treatments spaced 4 weeks apart for that. There is no treatment on the market where if you're going on holiday next month and you're thinking, oh my goodness, I need this thing away for next month, it's very unlikely that that's going to happen. So it's those expectations. It will usually take a few months. The reason being is that no matter what we are doing to you, we are trying to invoke an immune response. So we're trying to get your immune system to pick up that there's a verruca there and deal with it. Now, the beauty of Swift is that it how would I find it? Is that there's no dressings. You don't need any local anaesthetic. It's pretty quick. It only takes 15 minutes. The treatment up. This is a little video picture of the machine up the very top there. It takes 15 minutes. Does it hurt? Many people will ask. It feels hot. I wouldn't say it's painful. It's just hot, and we can adjust the wattage that we put through accordingly. So the youngest patient that I've treated is 6, who coped very well with it, all the way up. So we absolutely can treat children. We would just adjust based on that patient's needs. The most amount of watts that we will put through at a time is 10 at a time, and we'll usually do 5 applications of that in your individual sessions for 2 seconds. So it's very, very quick. In terms of what it feels like, if you've ever used a pair of straighteners, it feels as hot as like if you've kind of hit yourself with a hair straightener. That's kind of what it just feels hot. But it's hot and then it's gone, and that's it. So there's no needles involved, there's no dressings. You can pretty much just go back to your normal daily activities right after it. There's no need to rest. Basically, it's very simple. And you would usually come for your first appointment, you would then come 4 weeks later, and then you would come 4 weeks later after that. So you would generally need 3 treatments in any course of treatment. If, for example, you had any spread of your warts or your verruca, essentially quite a lot of people get it in their fingers. That's fairly common, believe it or not. That would be treated as well. Now, because we are invoking an immune response, anywhere else that you have warts, it would be dealing with that situation as well. So essentially, they would be cleared up as well. In terms of costs of Swift, you're £125 per session. So that would be £125 per month. In here, we don't make you buy a big package all at once. You just pay for your treatment as and when you come in. And you would generally need a course of 3. Now, if at the end of that third, so we need to treat you for your third session, we wouldn't see you back unless you really needed to. We would usually say to you to wait 3 months, let your immune system, let what we've done to you kick in. And many of the people, I mean, to be honest with you, we've not had anybody come back that needed another treatment after 3 months. But for some stubborn ones, say you've had it for 10 years, or you've had it a very long time, sometimes they maybe need a bit more of a nudge. What we would usually do then is do a fourth treatment, but we would usually have a gap of 3 months between that to allow that immune system time to do what it needs to do. And usually by that point, they've gone away. So that's how it works. The other option that we have here in clinic, as well as Swift. So Swift is our first line because it's low risk. It's very, very, it's not traumatic for you. There's no risk of infection. There's, you come in, it's 15 minutes. There's no dressings required. There's no needles required. There's no, it's very, very simple. The other option that we do have is a small surgical procedure, and this is called Verruca needling. So let me just, so you can see here, Faulkner's needling or Verruca needling. Now, the surgery procedure is, what happens in that is we are still invoking that immune response in the same way that we would be with Swift, but it involves a local anaesthetic, and it then involves us creating a small wound around the main area where your verruca is. So what we would do is we would do what's called a tibial block. So one of the nerves near your ankle, and the medial aspect of your ankle, the inside bits of your ankle, there's a nerve there. We basically inject just close to that nerve and numb the plantar aspect of your foot. So we basically put that foot to sleep by giving you what's called a tibial nerve block. Is that sore? But I've done it to children where they've had big macerated tissue, where we've had to, a particular patient, this particular wee girl was 8, and they had been using over-the-counter treatments that had been advised to them via I think it was a GP that had advised, and the tissue just macerated. So she had this big mass on her heel. So for that, she needed that to be all reduced down, and we did need to numb the area. So we do these sorts of things on children. So it's not horrendous, right? It's just as soon as you start bringing needles out, people kind of wince a little bit and think, oh no, I don't want that. So it's just a wee bit stingy. Local anaesthetic is more acidic than your natural tissues pH. So it just, when it's going in, it can just be a wee bit acidic. But we'll usually always try and have the local anaesthetic at room temperature. That helps with any kind of stinginess to reduce that. So we'll do everything to mitigate that as much as we can as well. But yeah, so we basically numb the bottom bit of your foot. And then we essentially, where you'll usually with your verrucas, you'll have like a kind of mothership where it started from. And what we do is we use a sterile needle and we pierce the tissue, and we push the verruca, the virus, basically the human papillomavirus, down in past the dermis. So we create this wound. We do hundreds of little piercings. And that then essentially pushes that, the theory behind it is it pushes that down into the bloodstream, and your body then picks that up. So your immune system picks that up. So that's Faulkner's needling, or that kind of small surgical procedure. You'll generally only need that once. That is priced at £370. So you just come in and it's one surgical procedure that you need, but we will manage the wound until the wound is healed as part of that package. We don't like to just send you on your way and leave you to it, although you don't have to come back. We don't force you to come in to get dressing changed, but it's part of that package. So it's a package of care. So usually what we would do is, our protocol in here is we would have you come in a few days later. We would check there's no infection, that change your dressing. We would usually at that point do some laser therapy for wound healing on that area as well. Dress it all up, pad it all up so that it's not too sensitive for you, and then usually see you weekly until it was fully healed. And usually a couple of weeks, you're only really needing a couple of appointments, but everybody's different. So that is the two options. Usually verruca needling, before having Swift, it was something we did more often. But we're now finding that with the results that we get from Swift, we don't need to do that. And most people would rather not have a surgical procedure than have it. And the kind of, I suppose, the cost of it is a much of a much. The other treatments that we have to offer, you can see here, is conservative treatment. Conservative treatment means that essentially you come in, you get a free consultation with us, and we just advise you how to look after it yourself. So we will look at your verruca for you and then give you advice. You don't need to, when you come in with us and you have a free consultation, there's no obligation to have treatment. Now, if we can treat you on the day if there is time, if we don't have anybody else booked in right after you and you want to have treatment that day, if it's something like Swift, we can usually see you that day if we can. If it was a surgical procedure, we would book you in for that, usually within 24 to 48 hours. With Swift treatment, again, because it's a 15-minute treatment, it doesn't take long. We've usually got a bit more flexibility there. Your Faulkner's needling will usually allow an hour for that. So you need to allow an hour to do that. Conservative treatment, though, is a valid treatment option. You do not need to do any of these if you don't want to, but usually by the time you're coming to somebody like me, you are or have gone through something where you've had verrucas in the past and they've been an absolute pest, or you have kind of exhausted every other option and they're possibly spreading. That's usually by the time you come to us, you're starting to see them spreading and or going to other parts of your body, so usually your fingers. So general rule of thumb there, remember that they are quite contagious. They will move to other bits of your body if you're down and touching and doing stuff with that verruca, and then you're not maybe washing your hands right away. You're just putting yourself a wee bit more at risk. So just normal hand hygiene, making sure that you're using a separate towel for your feet and things, or you're drying your feet last rather than drying your feet and then using that same towel for your hands and things. So just general hygiene, things like that. Making sure that your bath mat, so when you come out, or your shower mat when you're coming out of the shower, things like you're changing that very regularly, especially if you've got a verruca. I would say daily. You really should just think about that. You're coming out, you've got verruca, you're standing on that. So just generally good kind of hygiene, really thinking about what you're in contact with and how you're. Sometimes it's just you don't think about it and you think, oh, as soon as somebody mentions it, you're like, oh goodness, that's so obvious, but it's only obvious when you know. So just things like that, giving you that best possible advice to get rid of it. A lot of people have that we've seen recently, and this is something that certainly when I worked within the NHS as well, we would say to, because we wouldn't treat these in the NHS. As I said, it's just the NHS doesn't have the provision for this. It's not life-threatening. They will just give you advice like I'm giving you just now and send you on your way. They will not do any surgery procedure on it. They will not do needling. They will not do laser. They will not do Swift. They'll just not do any of that. And that's fine, because conservative treatment is a valid option as well. But what they will tell you to do is to keep it filed down. Now, I just want to be really, really clear on this, because I've had a few patients in recent weeks who have been doing that at the advice of the NHS, and it's not the wrong advice. But what I think people are not realising is that what they're doing is they're spreading that all about. So if you're going to file your verruca down, you don't need to be filing it down to one that your tissue is all red and angry and almost to bleeding point. I had a gentleman in just earlier this week who it was raw. He had filed so badly, and it was just spreading all over his foot. He was just filing. Filing it once a week is more than enough. You're just filing it back, just try to annoy the tissue and also keep it from building up and almost like a callus. So you don't need to be doing it tons, and certainly don't be doing it until it's pink and red. But the other most important thing is it needs to be disposable filing emery boards. If you're using the same file and then you're not, just don't do it. Just get the disposable ones. You can pick them up from any pharmacy. You use it once a week, keep it filed down, and then that goes in the bin. You don't use it again. Think about if you're then, I'll just file my nails, or I'll file another bit of my foot, or somebody else picks it up and uses that same file, I'm sure you're understanding where I'm going with that. So make sure that you bin the file that you do use if you do that. But that's something that absolutely we would tell you to do as well if you're conservatively managing it, is to keep it filed down. But once a week's more than enough, and don't overdo it, that you're absolutely ripping the skin off and going to this pink, really angry skin. That's not going to be good for you. And make sure that it's a disposable file that you use, so you're keeping the hygiene there, and you're not, then using that file for your fingers and your hands, and you're wondering why you're getting warts and things on your fingers. So just have a wee think about how you're managing that. So that is it. In terms of with us, that's our 2 treatments. We do not use anything else. We used to use Verruca. We did that for quite a number of years. And the reason that we don't do that anymore is because of the number of treatments and the cost involved to the patient as a result of that. What we found when we audited our basically our clients, we would get, for most people, I would say, a resolution eventually. But it was that eventually. What we were finding was that we were having to do 8 treatments and then give them a break, because you can't, because it's caustic. You're then damaging that tissue as well, because you're putting this caustic agent on. The tissue is then more fibrous, and you're basically damaging the tissue. It was actually becoming much more costly for that patient. In some patients, it was costing them maybe £600-700 to actually resolve a verruca, and it just doesn't need to be that expensive. So when we audited, what we realised was that actually this wasn't ethical to do this to patients. It was just taking a lot more than what the manufacturer had said it would, let's just say. So that was that. But it certainly prolonging with it. You were coming every 2 weeks as well, so that was another factor. So it meant that patients had to come every 2 weeks. It's quite a lot of time out of their day to be able to come in every 2 weeks, whereas with Swift, it's once a month for 3 months, and the success rate is higher, especially for those stubborn ones. So that was really why we discontinued with any other caustic agents. That was it. It was basically down to the cost, the kind of, I suppose, ethics with the patient, the damage to the tissue, because we were putting that caustic agent on. So we were causing that kind of, the tissue was kind of more fibrous. And then also the cost to the patient, because when you added up, even though you're maybe only paying for each session one at a time, when you actually add up how much and how often you were having to come, it ended up quite a lot of money. So we decided to completely discontinue that as an option, because it was a bit of a false economy. So that was that. So we discontinued using Verruca, and we moved solely to, right, this is less of a faff for the patient, because there's nothing they had to do in the middle. They didn't need to be putting on any sprays or anything at home, whereas all the other, or certainly with Verruca, they had to follow some protocols at home as well. Whereas with Swift, they have nothing to do. Literally, they just come in for 15 minutes over the course of 3 months, and that's it. They don't need to do anything else. So it just meant that there was less for them to do, because if what we'd found through auditing was that the patients that, if you forgot to put your surgical spirit and stuff on, or you went and put enough on, or you forgot to do it for a day or two, or you didn't do it at night, the results would be all over the place as well. So it wasn't it just wasn't as standardized, I suppose, as effective as we would want it to be. And the biggie was the cost, the number of times that you had to come. So that time away from your time, coming in, travel, all of that stuff that we don't always consider. But actually, when you think about that, that's time away from your day, petrol, bus fare, train fares, coming in every 2 weeks for goodness knows how long, months and months. And the cost associated with that. So the cost of all those treatments. So that was our biggie. That was our decision for that. So Swift or a small surgical procedure are our 2 options. Please, if you're struggling with a verruca, just don't panic. I actually sent a message to somebody today saying exactly that, don't panic. Get the best advice based on you. So even if you want to come in, just get a little bit of advice based on your presentation. There's no obligation to do any treatment with us, but at least you'll have that peace of mind. You'll have the time where you're speaking to a podiatrist. We're taking the time to look at your clinical presentation and then offer you the best advice available for you. So at least do that and know where you're at, and then you'll come from an informed position when you then like, how do I treat this, and remember, conservative is a form of treatment. Okay, leaving it alone, it might just spontaneously go itself. Sometimes they do. You can have people that have had them for 10 years and then spontaneously start healing. There's no rhyme or reason, right? It just sometimes just happens. If you want to book in, there is a link with this. Please feel free to ask any questions that you may have. And please don't worry, don't struggle with Verrucas. We're here to help. We are based in Canning Park on Portman Street, but we also have a West End clinic within the Western Tennis Club. So I go in and do the West End clinic for Verrucas. Usually Sundays, Thursday evenings, Monday evenings. So there's quite a few there. Just pop a message or phone the booking line up and they will happily get you booked in if you're needing a consultation for Verruca. All right, we'll speak to you later and thanks for listening.